Hey guys, welcome to the Service Design Drinks. We're gonna wait a couple of minutes and then we're gonna start in a few minutes. Up until then, feel free to grab a beer, grab your drink, grab a soft drink, grab a rum as Adam did. And we're gonna start in a couple of minutes just to make sure that everyone is here.
Gabor, I'm just wondering if it's quickly, we can write a reminder email to all the people that still need to join.
That's a good point. I tried to do that in Zoom, but Zoom doesn't, I haven't seen an option to write. Oh, you raised your hand, very nice. I don't know if that's an option in Zoom. I haven't found one. Do you know if it works?
I haven't seen it either.
Because in Eventbrite, you can do that, I know, but in Zoom, there is no, I haven't found an option yet to just remind people. But we are like 12 participants so far, and I hope that we're gonna be more as time pass, a couple minutes pass.
All right, let's see.
So until we wait, I'm gonna just drop a question into the group. If you are a Service Design Drinks newbie or you have been to Service Design Drinks, and since you are unmuted, and we will allow questions throughout, but you can't really unmute yourself just to make the event smooth as possible, you could reply by using yes and no. And you do that by clicking on participants button. And in the bottom, you see a yes and a no and other options as well. So feel free to click yes and no to answer the question if you have been to Service Design Drinks before. Oh, we have 2 yeses, 1 no. Three yeses. I also pressed yes. Hey, welcome. We're gonna wait a couple more minutes and then we're gonna start as more people join. Feel free to grab a drink until we start. Drink of your choice. Okay, so we have 5 Service Design Drinks people who have been to Service Design Drinks before and 1 no so far. That's nice. Adam, did you find anything about the reminder link or email? No, right?
No, I didn't find anything, sorry. Still
okay, all right. We have quite some signups from outside of Germany. Maybe some of them could have messed up the time zone difference. What do you think, guys? Should we start? Or should we still wait a couple of minutes? We have one more person joining. Oh, from Bern, welcome.
Thanks, Gabor. I was muted.
I made you a co-host, so you can unmute yourself
Cool.
if you wish. But I was watching the chat before.
That's
So
okay.
what do you think? Should we start or should we wait a
Yeah.
couple more minutes?
I reckon you can start because we have
Okay.
some, the intro stuff, and that gives another 5 minutes before the really hearing their talks.
Cool. Yeah, let's do that. So welcome everyone. This is the July event of the Service Design Drinks. As you said, as you've seen maybe in the introduction, please grab a drink, which is not this slide, but this slide. Do you have a drink? I see Alfred has a drink. I see a couple of you have drinks already. Prost, cheers. And again, welcome to the July event, which is about designing for patient centricity. What is the service design drinks at all? What is this whole thing all about, Adam?
That is a good point. So we've been doing the service design drinks now for this year. And I just realized that someone is having a bit of difficulty joining the service design drinks. So if you know other people that have also said that they would like to join, you can also invite them with a special link that we might be able to send out. Maybe that's what we can do, Gabor. I just got a couple of messages saying people can't join at the moment.
Send us a special link, Adam, and we could actually post it on social media and stuff.
We can use this link.
Yeah,
I would say. If people would like to join, they're going to join as me, but let's see. Anyway, so we're doing service design drinks now for the last year, which we got over from another crew. But we've also been a long-time team of Jam Berlin, and there's some news about that coming later in the event. We love everyone, and we're really opening, accepting community. And what we are trying to do is also get a lot of service designers together, designers of all different kinds, to share their thoughts and opinions. And this one is really, really interesting because it's actually really helping people's lives. And yeah, so meeting people, leveling up and skilling up, learning new things, asking people different questions, sharing and learning, practice speaking and coaching. So of course, we also we have a Slack community if you'd like to join that, and people have asked questions there and joined us there. And also, if you want to practice speaking at some point, or you've got a topic that you would like to talk about, you can also apply for one of our small talks, and you can put yourself in front of the stage and do that. So we're always looking for people to share some thoughts and feelings and design things as well. So that is that. And yeah, also having drinks and just socializing in general, because, you know, at the moment, it's a little bit hard.
Yeah. So who's behind these service design drinks Berlin? So first of all, we are a team of 5. There's Mati from Fjord as a service designer, Melanie from BCG Digital Ventures as strategic designer, and they are probably not going to join tonight. But the 3 of us, D, maybe you've seen D before talking, freelance product strategy consultant, Adam, who just talked, service designer from Zalando, and myself, strategic designer from Helios Clinics. And this is a team who has been running service and drinks from this year. And we're really happy to see you at this event. Over to you, Adam.
So yes, just a couple of things to mention. Of course, that you can talk privately amongst yourselves and connect on Slack, but we also ask that you be respectful. If anyone breaks the rules or you feel uncomfortable, then please let us know. We try to be as inclusive and including as possible. This is currently being recorded and will be uploaded to YouTube. So if you don't want your beautiful faces uploaded onto the internet, then you can also just turn your camera off. Say hello. I can see some people are from, yes, my Frank, lovely flower got mentioned here, but I sit in Berlin, and it's great to see where old people come from internationally. And ask as many questions. You can do that at any time, and we'll try and collect them and answer them all at the end, or just see how we go throughout the time. and there'll be a Q&A at the end, so do that. You can also do like snaps or even like this in the camera so that we can see your applause if you want people to keep talking. And if you really like what they say. And like I said, you can join our Slack group as well. So there you go.
Yeah, visit sddberlin.com to read about future events, to read about us a bit more, and also to join a Slack group, which is a good place to talk about and service design and share stuff on service design. So sorry, I'm just jumping around and trying to let people in and then trying to manage the slides as well. So who's talking tonight? Say again?
I can let the people in. You don't have to worry.
Oh, great. Yeah. Cheers. So who's talking tonight? I'm really, really honored to have Alfred Angerer, I have to say it in German, speaking about the patient-centered process design, the lean approach. And beforehand, I'm going to share you a couple of thoughts and a couple of examples from my perspective on patient centricity from Helios. So I think tonight we're gonna give you a good perspective on how hospitals operate these days, at least how hospitals in the German-speaking area, so we're gonna focus a lot on Germany, Switzerland, and Austria, how patient centricity works generally in the hospital world. And we're going to do Q&As. So I'm going to talk for 10 minutes, and then we're going to do a Q&A, and then I give it over to Alfred, and he's going to do the main talk about the very, very interesting topic. I'm looking forward to it so much. And then we're going to do a Q&A afterwards as well. And the way we do Q&As in here, if you're new to Zoom, is by raising your hand. And if you click on the participants button in your Zoom software or Zoom window, then you see the participants, and then down there you see the different options like yes, no, go slow or go faster, and also raise hand. So this is the way we're gonna moderate the questions. So once the talk is over, you're gonna have the opportunity to ask questions. And we're going to do it by raising your hand, and I will give you the mic. I will unmute you, and you can ask the questions, and then we will pass it on to the person who can reply and answer. And I think that's it so far. About introduction, have I forgotten anything, Adam or D?
No, looks good to me. Should I introduce you?
Yes, please.
Yeah, so this is Gabor. We've known each other for quite so many years. He's a fantastic dude. He has a gorgeous little child and kid, and he also drives a Tesla 3, so he's very environment focused. He's been working at Helios for some years now, and he has a really nice office. If you ever get to do a tour, I would say come to Berlin, or maybe not this time, but it's a really nice office. And he's been working real hard to save people's lives, and I'm really excited to hear this talk because I haven't heard Gabor talk before, so actually it's my first time. Yeah, there you go. I'm excited for this.
Wow, I melted, man. Melted. So yes,
you, my friend.
Thank you very much. So the small talk is briefly about patient centricity at the Helios clinics, and I have to click back to the presentation. So this is me when I started to work at Helios 2.5 years ago, around 2.5 years ago. And I quickly realized once you start working in a hospital, it can get really easily overwhelming. And you see a lot of information everywhere. You see a lot of stuff everywhere. And I just, I was overwhelmed in the beginning. And I see things that run in the background. I see different things, how operations run, how wards work. I see a lot of shortcuts. Shortcuts could be the things that you hear very often if you talk about hospitals. Shortcuts, how hospital staff tries to solve local small problems, how to make their lives better. And I've seen a lot of interesting things as well. This is a stress pillow, let's say, a stress box for at the admission at one of the emergency units. And after learning a lot about the hospital world, I really developed a deep respect for people working in hospitals, because working in hospitals is really not an easy thing. I just put my beer down. So learning about this complex world made me learn a lot of things, and I'm still learning every single day. Now, some words about Helios. It's quite a big company. We have 132 hospitals over Spain and Germany. We treat around 70 million patients a year and have almost 100,000 employees. You can imagine how big this company is. And this is the slide we get at the onboarding presentation once you start working at Helios. Just to give you a couple of numbers, just to give you a concept of how big the company is. We treat 35,000 patients one day. We distribute 74,000 meals just one day, and we also invest 1 million euros into our hospitals a single day. So it really allows us, as a private hospital operator, as Europe's one biggest private hospital operator, to reinvest a profit into development. And that's maybe one reason for a privately owned hospital operator, which is always a debate. Hospital operators should be private or should be public. Now in Germany, hospitals are full of contradiction. Hospitals in Germany, at least, exist to provide excellent care and at affordable cost. And that means quality has to increase all the time, while costs have to go down all the time, every single year. And that itself is quite a complex constraint. And just to understand that, and just to understand how to operate in that world, requires a lot of time. And here are a couple of challenges that I've seen that I would like to share with you in this talk. So hospitals is really we do it like this because we have always done so world. This is an answer once you talk to hospital staff that you get a lot of times. And here are a couple of other contradictions that are experienced, or challenges that are experienced throughout my 2.5 years at Helios. So hospitals apply, cutting edge medical technologies, cutting edge treatments, but in 20 to 30-year-old structures. So it feels like to get a treatment in a hospital, cutting edge treatment in a hospital, that this is the most innovative place on earth. But then once you get to know how hospitals operate, and of course, many of you have experience about waiting rooms and waiting times and how digital hospitals are at all, then you realize the structures behind are maybe not that cutting edge. One other contradiction that I find very interesting is that a physician or a nurse should really specialize in the career, should really just specialize in one field. However, we know today change is not really possible without collaboration. So every single day we try to overcome this thing, how to make deeply specialized people collaborate. That's sort of like a really hard contradiction from my experience. And the third really hard contradiction is keeping everyone happy is impossible, but it's critical. So once you've launched a new solution, launch something new, once you initiate change in a hospital, you really have to get all those different stakeholders on board with very different needs from the nurses, through the physicians, through the people working in the background, to make a new solution stick. So I brought you a couple of examples just to show you what sort of challenges we have been and we are currently working on. And one of that would be a case from the emergency admissions in Wuppertal. So we got a call, we got an idea, or how do you say? I'm trying to translate the German word to English. So we got sent in a problem about waiting line. Treatment time just takes too long, and we met a physician in Wuppertal who really had some ideas how to improve the whole treatment time by changing background processes. So we invited the whole team from the emergency admissions to Berlin. We did a small kickoff, a 2-day kickoff presentation workshop where the team had a chance to talk about the process and to change it. And then they changed it, went back home and implemented some parts, and then we supported them with testing and creating a handbook, so really they can give it to other colleagues or new people coming on board and maybe understand how this whole treatment really works. If you want to get into details, feel free to go to medium.com /GBRKHLM. That's my Medium website. This case I tried to write up more in detail, because of course in this short period of time, I'm not going to have a lot of time to talk about many details. The next case is also, I also written it up on Medium. I try to do that once in a while, once I have time to write up the cases. We got a challenge from the executive level, so that we should tackle the shortage of nurses and hire 1,000 nurses in 2019. Quite a easy challenge. So we designed and tweaked a small design sprint and then presented some solutions to the board, which was a very short but very effective way of kicking off developing new value propositions and kicking off the new solutions to finally tackle the shortage of nurses holistically at Helios and centrally. So they grounded a new department, and they established a countrywide campaign with a very fast candidate experience. If you're interested in that, you can either Google the wichtigste Job der Welt that you see on the screen, or go to the link that you see on the screen, or go to Medium. They also written this case up. And I'm very proud that there is all of the work we did. It was really to be seen on the streets. Case number 3, which was very interesting, a challenge we got from our chief medical officer, is about centralization. So the question was, how might we centralize complex operations in order to increase medical quality? You can imagine how complex it would be to invite physicians and let them decide how and what to centralize in such a huge network. So we implemented, or we applied Lego Serious Play to be able to discuss and build different ideas in a different way, which turned out to be very fruitful and very effective. And then we did a huge research in oncology in order to discover the whole cancer patient experience, because at the end, it was all about the cancer network. And I'm also really proud that we come up at the end with a new way of guiding the patient throughout the cancer experience from a Helios side. Now here, it was very interesting to experience how physicians especially work and think differently in a group by using different methods. So normally they discuss for a long time, but this time by using Lego, we really could build mindsets together that really guided through the whole process. Because for us, it was very important from the beginning on to win those people for a shared vision for the whole new concept of a new cancer network. And by discussing it, by falling back to the old habits, it could have been fallen short for sure. That was a very interesting experience. And the last case, we did in Spain, which we get a very concrete question to increase number of births in the Spanish hospitals. We ran a series of different workshops and activities, and I would just highlight one thing. Once we developed the prototypes and value propositions after the design sprint, implementing process was really a big struggle. So imagine you have the app and you have a website, you have cool new digital products. Patients may love it, but how do you make people implement it in the hospitals? How do you make them run the background processes? And this is the thing that I'm really interested in. And that's definitely a huge challenge in every single organization and also at Helios. So we had to run, the idea was to run a series of different workshops to develop a standardized process of how birth works, like pregnancy and birth, and the fourth trimester works from a patient perspective, to develop a central understanding, and then go through the single hospitals, visit the multiple hospitals, and let the physicians and let the midwives give their feedback and develop KPIs for their own. How would they like to measure it themselves, the success of each stage, measure themselves, and also add different services they can sort of sell or offer to the patients. And at the end, this whole process with the whole KPIs went into the enterprise system of the hospital. So it's accessible from every single hospital, all the 55 hospitals in Spain, so they can have centrally measure the success of each step from the hospital perspective. That was very interesting. I think, and this is a website you can also go to the link that you see below. So quioansalud.es/embarazo y maternidad. Or just look for embarazo, that's birth, at Quioan Salud, and you will see the fruit of this project, which I'm also really proud of. That was it, a very short overview of what are we currently doing at Helios and how patient centricity works from my perspective, my personal perspective, from my experience from the past 2 years. And now I would like to throw the ball back to you guys. So if somebody has question, feel free to raise your hand. You do that by clicking on the participant button, and on the bottom you see the option to raise your hand, and then I can give you the word. Any questions?
I have a question to start with, if no one's raising their hands yet, while they're thinking of their question. Shall I?
Yes. Yeah.
I think that this was a new initiative by you, right? To be more patient-centric or user-centric.
Yeah.
You might know it. How did you, is there any advice you would give to other people that are wanting to be more user-centric? How to get that started in their organization? How did you do it?
Yeah, great question. Currently also working on it too. I'm asking myself every single day, how do you translate user centricity or patient centricity into the language of the organization, which in our case could be quality management, could be hospital directors, or could be physicians. And every single stakeholder has a different goal that they want to reach with patient user centricity. And my answer right now would be measuring and measuring stuff that you can really change with patient and user centricity. We're trying now to implement new ways of measuring patient experience, and also measuring how patient experience could have an effect on employee experience, and how patient experience can really help you to keep your staff, to keep sick leaves low, to keep fluctuation of the staff low. Yeah.
Yeah, cool. Thank you. Are you seeing the chat now that there's like a question from Hengamer, and then guest maybe also has a question, but they didn't see the raising hands thing. Do you want to redo this one? I think it's the first question. Have you started a project to collaborate with other hospitals for very rare diseases? Knowledge is limited.
Have you started a project to collaborate with other hospitals for very rare diseases when knowledge is limited? No, but interesting question. Definitely, there is definitely a big demand for new ways, new languages of collaboration, as design thinking and design in general is definitely a new language for collaboration, and I embrace it at Helios. But the more specific field you dig yourself into, the more complex the thing is, from my experience. And that's why we didn't really get to work with rare diseases so far. I'm doing a lot of, from a hospital perspective, a lot of generalist stuff, like recruiting, like cancer treatment. And I haven't had a chance to dig very deep into different different rare conditions.
It sounds
Yeah.
This person, Hengame, I don't know if I'm saying it right, has some, maybe you're joining this event because you have some also experience in it. Maybe if there's the discussion at the end of the event, can add more to it. But then I think other people are now asking some questions just in the chat. Should I help moderate this while you're answering them?
Yeah, that sounds good. Yeah.
So guest or Jerome, I think had a question but didn't type it actually. Did you have one? You can type, or maybe should we unmute you to talk?
I can unmute. Yeah.
Hello.
You muted. Yeah.
Hi. Sounds super interesting what you're doing. I think it's always good to have a designer in a hospital and a chain of hospitals. Even just to be like a pivot between specialists and to find opportunities. I was just thinking, like, what is your vision on, for instance, the last example that you gave was about how do we get more births at our hospital. That's more like a sort of competition towards other hospitals, right?
Yeah.
Is it super patient centric, or is it more, well, more sales driven?
So yeah, I think I get your point. And so since we do have, so the goal, the thing is that other hospital chains in Spain, especially, taking the patients from us, and they see a decrease in the birth numbers, and they figured out that it may be due to patient experience, maybe due that we are too slow with giving appointments, so we are too unfriendly, we are not getting the required patient experience scores that we should get. So we really have to improve the patient experience. That was the idea behind it. And of course, sales at a hospital doesn't exist. I mean, in Germany, sales doesn't really exist in a hospital. It's not even a department. It's called marketing. And you can either do marketing for a hospital, or you can just improve the service, or you can improve the things that you give to the patient. And then you automatically get more patients through the word of mouth. And there are a couple of other ways as well, but that was the idea behind it.
Okay.
Yeah.
Thank you.
Cool.
Yeah.
Oh, yeah. Looks like there's 3 questions now. Next one is Anne, then Frank, then Anna. Do we have do you have a time limit, Gabor? Is 3 questions?
We planned, Alfred, to start 3 minutes ago, but I think I planned enough time so we're gonna finish by 8:40. So I think we're still gonna have time for the 3 questions, and then I'll pass it on to Alfred, if it's fine with you, Alfred.
Cool. So I think the next question Anne wrote, how do you manage to integrate the employees in the design process despite their limited time, I guess, if they're doctors and nurses and patients? Yeah.
Tough one, definitely. They don't have time. No hospital staff has time. You have to design yourself around it. For me, the easiest way is just to connect into the existing event structures. So a couple of hospitals have general meetings and like team building events every year. And there you can get in just to have their attention, have their time. You can reach them, or you can talk to them in the break room, or when they're having lunch. They're happy to talk, but they just don't have time. And that's a crazy constraint. And it's more a constraint for implementation than for the idea development or the early stage of the development. Because how do you change behaviors? How do you change the way of doing things when people who should do those things don't have time to learn about it? So I think there is different experience, but not really a clear answer to that. Yeah.
The next one from Frank, just so we go quickly, was, do you have an example for one small workaround that you managed to solve for hospital staff, like the box that keeps the lid from the trash bin open? I loved that photo too.
Yeah, there was a very interesting example that it's called a team timeout. We supported a team in implementing team timeout in one of the hospitals. So once it's getting crazy in a ward, in a hospital, people just run around and try to solve the problems that they face right away. And team timeout is about looking up for a moment and see what others are doing. And then ask questions. Hey, could you help me do this? And then we can do that together. Or could someone take this over from me? This is not my field of specialty. So these team timeouts are like a small team hack that could really help the team to just, very agile, very on the spot, decide and prioritize the tasks together.
Cool. I love that myself, actually. Awesome. Last question. And Yaron asked another one, but I think we'll save it for the end. Gabor, you can decide. But the third question was from Anna. And I just, maybe I can't do it. Maybe you can ask to unmute yourself, Anna, because you didn't type the question.
I'm unmuted now, you're right? Okay. Hi, I wondered if you're redesigning a patient experience, are you also able to look at other healthcare providers outside of the Helios ecosystem, like a GP, for example? Because that might be really important for patients, like problems happen in between these borders of the different providers. Is this something you're able to look at, or is this like step 200 for you? And
very good question, Anne, sorry. Very important part of the patient experience from my experience as well. We're currently doing a project where we try to digitalize a bit the touch point or the link between the GP and a hospital, a general practitioner in a hospital. And there is a tough one because a GP wants to stay independent and not bound to any provider. That's their value. And you all, as a patient, you also would like your GP to be independent and see what is best for you as a patient, not what is best for Helios, for example. Because that's always a tough fight, how to connect a GP, for example, to the Helios ecosystem while he can stay independent. So we're experimenting in this field, but it's not an easy place not an easy challenge to solve. Yeah.
Yeah. Thanks.
Yeah. Thank you.
So there was one more question, but do you want to save it for the end, or?
I can just, maybe you can make that as the last one, and then Alfred can start right away.
Do you see it there? It's the last thing in the chat. Do you get the briefs, or do you create your own projects yourself? You see that?
Both. A lot of times we get a brief. Yeah. What is the brief from a hospital staff perspective? That's maybe, I don't have time to do stuff. I don't have enough people. So like very general problems, and you really have to do a lot of reframing. So I think brief is always created from my perspective by myself. I really had to ask a lot of questions to understand what is really happening. Is it a thing that we can measure? Is it a thing that we can get a report of? Is it something quantifiable? Is this a problem that you can solve on your own? Or is it a too big problem? Because we always get, in a hospital, there's always a wall that you're running against if you're doing too much. And I think Alfred is going to talk about it as well. Since hospitals are very complex things, and there are a lot of regulations like laws and data security that really tries to secure patients in this world from make it dummy proof, let's say, or make it very secure. There's a lot of things that you just can't change. And I think that is important to, as you say, quantified pains, to really to be able to understand and translate the problem that you get as a brief or as a problem. Try to measure it and try to come up with ways to create an impact in there. And measuring is always a huge problem. But then also realize how much you can do. You can never do enough, but you can do something, and that's that's sort of my guide when creating briefs and creating projects. Yeah. Did it make sense, Dee? Or did it make sense, Jérôme? Okay. Okay, yes. If there are more questions, of course, or if I didn't really reply to the questions that you were asking, or if you have more questions, we're going to do more of a Q&A at the end. But now I'm really keen on hearing our next speaker, with the big talk, Professor Dr. Alfred Angerer from the Center for Healthcare Management and from the Zurich University of Applied Sciences. I had the chance to meet Alfred. I heard first Alfred from his podcast. It's called Marktplatz Gesundheitswesen. It's mainly a German podcast, but we also posted one of the English episodes. He's going to tell you all about what is it about me at the end of the talk. It's a very interesting talk, and I reached out to him because I wanted to learn more about Lean Hospital, the Lean approach, which he's going to talk about in a moment. And I was really happy that he said yes. And that he is gonna join us in today's talk and gonna talk about patient-centered process design and the Lean approach. Over to you, Alfred.
All right, thank you very much, Gabor. So I like the term the big talk. Let's see if I can really make a big talk here. But before I start talking, let me share with you my slide deck. And yes, do you see my slides?
I do, yes.
That's good. You know, I used to be a former consultant for McKinsey, so without my slides, I feel really nervous, but now it's working, so everything will be fine. All right, so thank you again for the invitation. And as you said before, Gabor, we want an excellent healthcare system. And if I make here a poll, what do you think? What is an excellent healthcare system? I guess many of you will say, well, obviously quality. Yes. If I go to a doctor and I have a certain pain, my first goal is for sure to get rid of that pain. But also, you know, it's a business at the end of the day. It's every year even harder to finance it. So we have to make sure that it's also at a right cost. And so people try to make their own argument. So what do you want? Do you want a healthcare system that's cheap or one that has a good quality? And obviously we want to have both. And the answer we have for that, how do I achieve excellent quality? And how do I reduce the cost? And how do I put the patient in the center? And well, what our answers to that? Let's make it the Lean approach. And it's going to be my talk for the next around 30 minutes. Before I come to the content, let me share with you where I am at the moment. Unfortunately, not in Berlin. Yeah, this is Europe, you know that. Switzerland in the middle. And if you look closer here somewhere where these lakes are, there's the city you know, Zurich. And the city you probably don't know, it's Winterthur. Although it's the 6th biggest city in Switzerland, but with 120,000 inhabitants, not that really big for you guys, at least in Germany and Switzerland. As I said, it's a top 10 city. And there's my university. I'm in the Center of Healthcare Management. And well, we try to make our processes better, our patients' experiences, and we try to make it as affordable as possible for everyone. So when I was thinking about this project or about this talk today, I was thinking about that going from a normal hospital to a Lean hospital. This is like a journey. And if I think privately about journeys, that let's say I say to my 2 kids, let's go to the mountains. Well, I'm in Switzerland, so it's not an unusual. They will always come up with 3 questions. The first one will be, why? Why do we have to go there? We're playing here in the computer. Why do we have to go out? And then I try to explain that to them. The second question that we always ask is how? How do we get there? Do we have to travel by car and sit there for 3 hours in the car? And the last question is always, what exactly are we going to do there? Are we just walking around? Are anything exciting to do there? And those 3 questions from my children, I think they're very good questions you should pose every time someone comes to you and tries to convince you that you should change your organization. So always ask why. Why should I adopt this new way of thinking that you're talking to me? So that will be one of the first part of my talk today. What is the vision that we have from a lean hospital? Our second question is about the way, how to get there, the transformation path. And finally, to make this concrete, because, well, at the end of the day, lean, as you will see, is a philosophy, and it's hard to talk about philosophies. I wanted to make it very concrete and practical. So let me share with you 1 or 2 tools and concepts that you can get a sense of feeling. What do you do in a lean hospital? So that's the structure. Let's start with the first point, the vision. And Gabor already mentioned my podcast. And the other day I was having a talk with one of the most famous design thinkers here in Switzerland, Christoph Vetterli. And he was telling a very personal experience from himself. He said, well, the other day I had to go to the emergency room. It was 5 o'clock in the morning. So obviously there was a lot of pain involved in this. And the first thing you have there when you enter a hospital at 5 o'clock in the morning, there you have someone, a professional. Most of the time it's not a doctor or a nurse. Most of the time it's someone from administration. And if you ask yourself, what kind of questions do you want to hear at 5 o'clock in the morning in a hospital where you are full of pain? I get something about how can we help you? How can we reduce the pain? Something like that. But what Christoph was telling me is the first question he got was about the insurance. And the second one was about which religion affiliation he has. So she was filling a form, and she was used to fill the form for every patient. And those are not the questions you want to hear there. So you already notice that this little example is our hospitals were not and are not built for the process, for the patient, for having what you guys most probably do all the time, the patient experience or the customer experience. They're not used to that. They're used to be like, you should be happy that you arrive at our hospital, that we treat you. Don't expect anything but that. And to be very fair with the hospitals, Gabor already mentioned it, they're very, very complex organizations. So let's take one very simple task you would have in a hospital. Let's say you want to discharge a patient. So you were at the hospital for 3 days, now it's the 4th day, and you're supposed to go home. So how difficult can that be, right? And so a hospital in the UK, what they did is basically, they try to write down every single step that is required to send a patient home. And they found a lot of steps required, many of professions, people involved in that. To be very precise, the discharge process looks like this. So you have there basically around 250 steps until someone is allowed to go home. You might see some groups like the patient and the doctor. Well, obviously they have to be involved in the process. But if you look closer, you will find something like a porter or even a priest. Well, so at the end of the day, I guess every of these persons has a certain reason why they should talk to you or have some intervention with you before you go home. But without being any hospital professional, I hope that you get a sense that this is so complex, and this is a process that cannot be fast, that cannot be reliable, there's a lot of improvement room in this process. So therefore, many of our experiences are about waiting, about people running around, about stress in hospitals. And obviously that's our goal and our mission, to change that. And if you start talking about people, about changing, I think we persons are most easily convinced if we see the ready solution. I can show you many, many slides, but I think it's much more impressive if I could take you to a journey and show you a real lean hospital. And a couple of years when I started with this, there were not that many. It has changed luckily and lately. but the very first one I saw was this one here in Seattle, so in the US. As the name says, it's a children's hospital. And basically what you have to imagine, there are it's easy operations that are conducted there. So we're not talking here about brain surgery. We're talking more a hospital at the ward we visited, where they make standard operations like removing a tonsils, things like that. So it's not really rocket science, but still you expect they are very high quality. Now, the very first impressive thing they were telling us was about their processes and how fast they were. So imagine you have an operating room, you have their team of nurses and doctors, and the faster you are, obviously the more operations you can do per day, the more money you are going to win. Now I'm talking about the business part. And well, for a simple operation, you would guess here in Switzerland, between two patients, there's a gap at, let's say, 60, 90 minutes. What they told us, well, basically, we operate a kit every 20 minutes. So from the kit arrives, the operation starts until the next operation starts, 20 minutes with cleaning, with everything involved in that. So it was really, really, really fast. So in a day, they could operate in one room, one team, 24 children. When you hear that, maybe you might think, oh my God, yeah, this sounds like conveyor belt, and they're operating child after child after child. What about the quality? And that's obviously a very good question. It's difficult to measure quality in healthcare. You wouldn't, yeah, well, when you think about it, what is a good operation? There are not that many good indicators, but one thing you can measure pretty easy is about the complications. So we are here in a hospital where you arrive in the morning, leave the same day, so you don't stay overnight. But if there is a complication, you have to stay there, obviously. So what they did is they started counting how often does an error happen during the operation, so that we have to keep this patient at home. And the answer was, well, that happened last year once out of 3,000 cases. So we have a quality very, very close to 100%. And obviously the patient, the children are very important stakeholder in this process, but if you think about it, that's not the only one. He or she didn't choose the hospital, it was the parents. And now let's put ourselves in the shoes of a parent going there, and let's imagine my operation is there at 10 o'clock in the morning. Me as a father, I would be completely nervous and devastated. I know it's very simple operations. I know that they don't do many errors there, but still every minute in the hospital, I will be nervous and suffering. So the shorter the stay, the better. Usually in our hospitals, what we tend to do is we try to, well, the operation is scheduled at 10 o'clock. Well, why don't ask the patient to arrive 2 hours, 3 hours, maybe even the day before, so we can just be on the safe side. Well, it's on the safe side for the team on site, but it's not on the safe side for me as a father. I will be nervous all the day. So why are you making me suffering? And what they do in this hospital is say, well, we try to optimize the process that we can already tell them, parents, arrive 1 hour before, be there at 9 o'clock. And by the way, we know that you will be in average 1.5 hours later. So we'll be together with your kid, we'll be on the car driving home again. So we make you only be here 2-3 hours instead of maybe 1 or 2 days that can happen in other hospitals. Now that sounds so far so good, I hope. The business guy is happy, the quality, the parents are happy, but still the system could completely collapse if you don't take into account one important group. And that's, well, obviously the workers or the employees there. Why is that? Well, there's scarce resource, and if they're not happy, they're going to leave your hospital, and then, well, that's the end of your hospital. So when you start measuring the happiness of people in hospitals, that's interesting factor. And obviously there's a big variation between houses. I guess in Helios, everyone is happy, but now let's talk about the typical average hospital that doesn't exist. And you will see there is around 1/7, so let's say 15% of the people of a hospital are really happy with their job. And 15% on the other hand are completely unhappy with them. So the typical ratio in a hospital is one happy employer facing another unhappy one. And so you could say, well, then the world is perfect, right? One happy, one unhappy, and the rest is just sort of okay with their job. The problem with this, and you know for sure from your own experience, the one person that is not happy, this person is going to make everyone know it. This is the person who is going to say how shitty their life is, how their colleagues are completely morons, how their boss is just incompetent of anything. Yeah? So basically this one-to-one ratio is not healthy for the whole atmosphere of a hospital. If you really want to get a better positive attitude in a hospital, you need to manage to make this ratio better towards the happy people, obviously. And this is not mathematics. What they told us and what they measured is as soon as they arrived at a ratio of 4 happy people against 1 unhappy one, then they did it. Then the atmosphere changed. Suddenly they were thinking positive, thinking about how to change things for the better for the patients, but also for themselves. I was there with a delegation from Switzerland, and we had their director of a hospital, nurses, doctors, and when they saw, and especially when they saw other professionals talking with glowing eyes about their new hospital, a new way of working, yeah, what they said is, we want to have it also back in our home, back in our hospitals in Europe. And our American friends said, well, yes, that's not a problem. You can have that. But there's one big caveat. And the caveat is, this is going to be a journey. It's going to be a long journey. We're not talking about months or maybe 1 year. We're talking here about a journey of 21 years. So they started 1999 with this journey, and they're still trying every day to become better. And the reason why it takes so long is this, what you're going to hear now about the lean hospitals. This is not about changing process and informatics and digital health. This is about changing culture. And changing culture doesn't take months, it takes maybe even decades. So let's deep dive into this philosophy. And the most astonishing thing is not a healthcare philosophy, it comes from the automotive industry. So this guy was one of the, or maybe the father of this philosophy of lean, Ono Taichi. And he always refused to give a short and concise answer, what is lean? And once he was forced to say it in one sentence, and he said, well, okay, if you force me, then let me reduce it to 2 things. Lean is about reduction of waste and showing respect for people. So this showing respect for people is, for example, one asked in the presentation of Gabor, oh, what kind of ideas do you, Gabor, have? Yeah. In the lean philosophy, they would say, oh, that's not the right attitude, or that's the right question to ask. We should ask ourselves, what can I do to make my people come themselves with good ideas? So we don't need the special expert on that and the lean guru coming outside my company. Our people are the best people to know how to improve things. And the other thing is they should focus on reduction of waste. And we have to focus on that in the second part of my presentation. So let's do that because this is such an important concept, the waste. In Japanese, it's muda. And so what you would always do in such a project, lean projects, is you would go there and just have a look at what's happening right now in a hospital, in your ward, in the emergency room. And you would always try to assess and ask your question, what is happening there? Is it something that is good and meaning good for the patient? Are we creating value? Like a doctor, she's talking to a patient and asking about how do you feel and making some analysis. This is value adding. This is really creating something useful for the patient. But you will see in a moment that there are also many other tasks happening there, like you're filling some forms that no one is going to see at any more moment of time, or you're going to wait around, look for information. So you're wasting a lot of time. You're wasting the time of your patient, the time of your employees. So this is what we call waste, or to put a definition, anything that you do, but does not create value, and for whom value is always for the patient. So the big question is, how much value do we see in today's hospitals, healthcare? organization. I'm focusing on hospitals, but you can apply this to any healthcare organization out there on this planet. Well, we went out there and we had exactly that question. So we went to one of our projects was here with a big Swiss hospital. And what we did basically is we took a shift of 9 hours and we just were following the doctor, the nurses all day and just writing down what they do. And so the result of this is the following chart. You see here 9-hour shifts and really talking to the patient. So at the bedside, making the analysis, giving some prescriptions and tips to the patient. That was around 20% of the time. So when I showed this slide to my students, and most of them are nurses or physiotherapists, they have to be just aware the moment you are going to be here studying for 4 years, 6 years, 8 years, however it takes until you're a nurse or a doctor. And later, you're going to use 20% of your time for doing that. So what's happening with the other 80% of the day? Here we have the waste corner where I can say as an observer, yes, you're wasting your time. There's three persons and suddenly one telephone is ringing. So the doctor has to go to the telephone and the other ones have to wait for him to finish the call. That's waste. Or where is my information? I don't find my documents, looking for them, waste. This is not that big. So it's less than 10%. So the rest here is what we call here indirect value adding, or if you want to be a more aggressive wording, you would call it hidden waste. For example, this big chunk here, 50% of the time we observed of these assistant doctors, they were spending their time in meetings and coordination. Maybe that's excellent meeting. Maybe it's a very hard case where they have the specialists from all around the planet discussing the best treatment. Or maybe this meeting is just one guy talking to another guy while 18 are just listening and everyone is not interested, and you could have shared this with an email, but now you're wasting the time of the whole room. I guess you have been in that situation in meetings. So you would ask yourself, do we really need to pay this highly educated staff for 50% of the time for being in meetings? Most probably not. So we need to improve this. We need to improve this for everyone. We need the patient wants more value-adding time with the doctor. The doctor, she wants also more time with the patient. That's what she learned. And the business guy, they don't like paying for documentations, for running around, for being in meetings. So this is one of the few situations where you can have really a win-win situation, make everyone happy if you manage to improve this process. So this is only the first step. We identified a problem, and now with the lean philosophy, there's a big toolbox where you try to deep dive, where you try to find the root causes. Why are we wasting so much time and resources of everyone? I brought you one of the easiest one today, the so-called spaghetti diagram. So this is a tool you would use if you have a feeling that we are moving too much, we are wasting our time by walking around. So for example, in a chemotherapy room, you have the room here, and you have here basically you're following the path of a nurse there. And she receives the patients here, and then she brings them and their relatives to their seat, and then she goes to this, and then to this drawer, and then to this, and then returns. And so you're drawing here the path of this health professional. This is not high tech. There's not a GPS sensor or anything high tech. This is just what I did, for example, here in operating room. You're standing in a corner, you have a pen, paper, and you start drawing. You do this for 15 minutes, half an hour, how long you want, and then you calculate about the day, how much waste did we have there. And for example, this lady here walking in the single room, she was maybe 30 to 40% of her day she was walking. And she spent around 7 kilometers walking in this single room. And so the question again rises here up, why? Why do we pay you 40% of your salary for walking around? Why did we train you 8 years for doing that? And she was not happy, patients are not happy, the same thing as before. And then by asking the right questions, you will find out why. Why do I walk so much? For example, well, I first went to this closet because I thought my material was there. And then I thought maybe it's here or maybe it's in the third one. So the next question would be, why don't you know where your stuff is? And then at some point of time, we may find out it's not because she's not well trained or she forgot things, it's because they don't have a standard. Sometimes they store it here, sometimes there. So no one cared about having one specific place for that. Therefore, they have now to walk around and find things out. And so that would be, for example, a simple tool where you have identified maybe the root causes. We have the material at the wrong place. And the simple solution is, why don't we take half a day off or maybe a quarter of a day and start thinking where we should store things. And then we will save hours and hours and hours of walking around in the future. Most of this lean stuff is like really not rocket science. It's like little simple tools, little process improvements. And so sometimes you wonder, why aren't we there? So I would guess in Switzerland, we have maybe 30–40% of the hospitals who have experimented with lean. In Germany, I would guess maybe less than 5% or even something around that. No one knows for sure. So why don't we see it all over the place? If this is so great, if the patients are happy and the people and the business guys as well. It's a very good question. And my theory is the following, why we don't see it everywhere. I have to explain this with a little bit of system thinking about loop back that happens there, or vicious cycles. Sooner or later, you will have bad process. Like you had a form that was very useful in the 70s and you were filling that out, but nowadays you're still filling it out. But you don't use that data anymore. That would be clear waste. Yeah? And these bad processes that always come up with the time, they lead to stress stuff. You are stressed, you're running around, where's my material, where's my information? If you are stressed, you don't have time for optimization. You go to your job, you start at 7 o'clock in the morning, you work 12 hours, you go at home in the evening. When should I start doing any optimization things? Yeah? So, and that's going to create even worse process. The business side of this is you have bad process, means you're inefficient, you don't have money, low profitability, so there's no money for anything to do any fancy design thinking workshops. That's more like the internal part. I call this a drowning cycle. So help me, I'm drowning, but I don't have time to learn how to swim. That's a very typical situation that many healthcare professionals have at the moment. And imagine now from the patient side, if there are stressed staff, yeah, you will have a very bad experience there. Stressed staff, they do errors. We have plenty of evidence on that. And they give you a bad service. They have exactly 30 seconds for you and to show empathy. They cannot do that. Yeah? So you will complain as a patient, right? So, and they will put even more stress on the staff. So this is the cycle Sisyphus. You really try your best as a health professional, but you get complaints from your boss, from your patient, from everyone, and you don't understand the world. Yeah? If you know about this system theory, you see everywhere plus signs. So the following simulation is maybe not that exciting. Over the internet, it might be not that smooth, but I just gave a little impact here on stress staff. Your colleague, she is ill. So you are going to have even less time for anything. Your processes are going to be bad. You're even more stressed. You're going to do errors. Your patients are not satisfied, and so forth and so on. And you are not going to leave this situation ever in your life. The system is stable at the worst possible situation. And obviously that's not the end of my talk. Hopefully not, that you are the worst situation that you can ever imagine. The big question here is how do I get out of this vicious circle? And there are many answers, but the bad news for you guys today is there are no simple answer and they're costly. So I always suggest is, why don't you try to get into this situation where you don't have time to optimization, is, well, where you have to invest. You have to invest time, you have to invest money and make some room available. For example, we were doing a project with a family doctor, and we told that, yes, we can help you to help yourself to improve your processes, but you have to close your organization for half a day. So Friday in the afternoon, you're not going to accept patients. That's going to cost a lot of money. Yes, but it's going hopefully to create better processes. So your staff will be less stressed, themselves will come up with new ideas, and then so the whole vicious cycle turns around and becomes a positive cycle. And this is not just theory, this is, as we're in applied university, that's what we try to observe and to promote in our projects all day, and what Gabor also does in his hospital. And so I brought you an example from Austria in this case, from Graz, with our project partners, Walker project. What we did that is they had the challenge, or the hospital had the challenge that there was a fusion of two departments and they were building a new emergency room for children again. So creating a new building, everyone in the audience here who has ever designed a new building, a new house, you know how complex that process already is. But now combine it with two departments that are going to merge together. And now this explodes the complexity. Well, there are so many questions. Who is going to be the boss of whom? Who reports to who, which person? And I'm going to lose power. And hospitals, and especially in Austria, but also in Switzerland and Germany, hierarchical. Yeah? So everyone is trying to put them in best place. So this is the best situation for the perfect storm, for the worst project in your life that you can imagine the situation. So how do you get out of this very difficult situation? And our answer is with a beer tent. Yeah. Why don't you put a beer tent in your parking slot? That's exactly what here Graz did, and you do what you know from your service design work. You do a design thinking exercise. This time not about designing a product, designing the process, the experience a patient walks in. And now what? So you know this, your cardboard engineering, however you might call it, with the simple methods, simple words that you move around. You just play with the person. So this is a real doctor there, and he and his team, he was working there. And how do we try there to create a new, or design the new process, and where the building and the walls and the room should be. And so when I was there, for example, there were the experiment, what happens if we take 50 children, 2 classes, and they send them into the system and try to see if the system, if the people there can really hold with vast amount of burden. And yeah, it worked. Not everything was perfect, but the most important thing was that they themselves developed their processes. There was no architect telling you this is the size of your ward. They themselves designed that, and they optimize themselves. And that's, so from the change management perspective, is the best thing that can happen there, because they are responsible for what's going to happen there in the future. So if you are more into business, the very first question I always get is, what does this cost? Money is always tight in healthcare. Well, the tent is about 600, 800 euros per month. That's nothing. That's not the costly part. The costly part is this, guys, taking them for half a day, making a workshop, making them 3, 4, 5 times, however long it takes. This is the costly thing. But you have to know that this building, it's going to cost anyway 50 million, and it's going to be there for 40 years. That's a typical duration that we use our hospitals here in Switzerland. So the question is, the statement is, this cost of having this workshop is absolutely nothing compared to having the cost of having the wrong building, where for the next 40 years, your patients are going to be suffering. Your staff is going to complaining every single day, why did we build it this way? This is not helping us at all. Obviously, this is more one of the big projects we make there, observe out there. And so if you are just working in an organization, and I'm talking about healthcare today, but this is also applies to everyone out there, is what can I do if I'm not the director of such a big organization? What you could start from Monday on, or from tomorrow on, is maybe try with Kaizen. Kaizen, this is another Japanese word for improving for the better. And if we say that lean philosophy is about empowering people, respecting people, and getting their ideas and asking them, how could you improve your work every day? You need something to structure that ideas. And what we did, and for example, this is my personal board with my team here in Switzerland. But if you happen to come to our hospitals, you will see boards like that in many, many hospitals by now. So how this works is you as an employer, you have an idea. So you go to the board, take a piece of paper. There are, again, not rocket science, but on this piece of paper, this Kaizen card says, what's the problem? For example, one of my employees said, we have so many folders on our computer, it's hard to find the right files there. Idea, well, why don't we have a structured way of saving our files? What are the advantages? Well, we would save time, and that's enough for me. So he or she put it here on the idea board, and we are standing every Wednesday for 5 minutes in front of this board, and then we have a look at the new ideas, and then I take the idea, or anyone moderating, and says, okay, here we have an idea from XYZ. Why don't we do this and that? Then we discuss it. If we think it's a good idea, it moves one field to the right, and then this is to do. Then we start implementing it. It's in the doing, and some point of time it's done, so it gets here. Yeah. So very simple tool. What we do in addition is we count the ideas, and so when we have 20 ideas, we celebrate that, and we have a little event. And well, I'm not in investing banking, so we don't go to the Bahamas, but we have a pizza or something like that, simple but powerful, are showing the people we care about your ideas. And it's good for every one of us if we try to really collect those ideas, visualize that. It's a very important part to see really the paper, how it wanders from the left to the right. And so this is, I think, a very good, simple thing you would observe in many wards by now, where you have the doctors and the nurses standing in front of, I don't care how it looks like, but a similar idea, Kaizen boards in our hospitals. So this is a very short thing and very short example. And we have many books with many, many, many more tools. So what I can tell you now is, why don't you have a look at what we write? Unfortunately, most of that is in German. That's in healthcare, at least in Switzerland, you have to communicate in German, and otherwise you're lost. We have one book here, The Better Hospital, who is at least in English, but most of the things we do is in German. And as Gabo already mentioned, if you speak German and if you're interested in the healthcare sector, why don't you come to our podcast and have a listen to that? I would personally suggest to hear this about design thinking healthcare, where I talked to one of the gurus here in Switzerland. So if you want to know more, what does it mean to connect those two words, the process optimization of lean and the design thinking, service design thinking philosophy, why don't you have a listen to my podcast? And now, enough said, my beer is getting warm. So thank you everyone for being here, and I hope that you have some questions for me.
Thank you very much. A clap here, and clap here as well. Amazing talk. I learned really a lot, and a lot of interesting points that resonate definitely with also my experience. Thank you again. Now it's up to you guys. Either you raise your hand with the raise your hand button, or you can just post and chat in the chat if you have a question, or you can type your question right into the chat, and I'm just going to moderate and read them out loud to Alfred. So we have already, I also have one question, but I've seen that we also have one question from Hengame. So I can't unmute. Maybe I can unmute you, and you can ask your question personally. Here we go.
Okay, thank you so much. This has been a really great session. So this is really, like, I'm really in tune with what you're saying and what you're trying to solve, which is, I'm really happy to hear all this. And being a patient myself at Helios, I realized that the doctors are a huge influence for patients. And I believe that emotional intelligence plays a huge role. And if we're not educating these doctors and improving their emotional intelligence, then the patient is, you know, it's kind of like a domino effect. So if you don't fix the big problem, then it's just going to affect everything else. So even if lean comes into the picture, we're solving something that, as Adam mentioned, you know, in the workforce, where, you know, half of the people are not happy at their work because they're just not qualified for that role. Now, how do we improve when it comes to the healthcare industry and the hospitals? How do we get the right people who are actually, you know, passionate and have the drive and want to be there? And I think emotional intelligence is huge. And how has that been implemented, or has that even been thought about? Because lean, I think, is improving the process. So has that even been discussed, you know, or implemented, I guess?
That's a huge issue, and I fully agree with you. So imagine being a doctor, and let's say after 8 years, you start working there, and you have all your drive, as you said, you have your visions, you want really to help people out there. And then you notice that every day you arrive there and you will spend half of the day in meetings. Yeah? So we are excellent in driving out all the emotions and all the impulse and good thinking of our staff there. So the very first step is already just giving them the time and the possibility to do what they really like, to follow their heart. Yeah? So even if you're the most empathic person of this planet, if I know I have exactly 58 seconds to talk to you, it's not going really to help me. So empathy and showing emotional intelligence needs some time. So making the time available, that's something that we make happen. On the other hand, you know, what you should start already, and you would find many people in universities and who say we are not good enough already training the people in how to communicate and how to be, how to feel what the patient feels there. So we need both. We need to train them better, and we need to give them an organization and an environment where they can apply that knowledge on how to communicate to patients. You know, at the end of the day, I'm also into digital health research, and there's always a question: are robots going to replace the doctors and the nurses and the therapists? And what I say is, well, you know, one thing you will never be able to automate is the empathy of person. So if I have a terminal cancer, I don't want to have a machine telling me that. So if we don't manage our doctors to be more emotional intelligence and show that person, so we're taking away the last reason why it should not automate their job. So there are so many reasons for making the right environment, giving them the tools, giving the time and training them. Yeah, that's for sure one big part also of the lean philosophy.
And one point from my perspective as well, very, very good point from you, Hengameh. I also think that way, that we were doing, and you can also see it in a chart, we are enabling hospital staff to do more, generally speaking. So whether you want them to be more empathetic, you want them to have more time, you want them to implement new groundbreaking digital solutions, first you have to get time for them and achieve that they really can think about those perspectives, because this whole stressful environment really doesn't allow them to do that. So this is the way I understand my work, and also the couple of perspectives that Alfred presented go that way.
I think I just wanted to clarify that emotional intelligence, there's a lot of different angles to emotional intelligence. There's one with yourself, and then there's one with, so it's more than just empathy, and it's more about being aware of yourself. So I think the education for doctors should be more than just their knowledge of how to fix a problem. It needs, and communication can be very limited, it can be very short. It's just, they just need to, it's, you know, it's body language, it's acknowledgement, it's affirmation, you know, it's very, you know, it's quite polished. It doesn't have, the time is not needed for empathy. It's just, you know, they got to be sharp into understanding, you know, communicating with patients at a level where there's no words, that's what I'm talking about.
I want a small example maybe from American Hospital, where they did a survey on the patients and they asked, what do you expect from us? What would you like us to change? And one of the top points was a very, very small one, but I think very important was we would love if you would knock on the door before you enter my room. You know, this takes you exactly half a second, but this is so important for them because you are showing their respect that I'm not just a piece of meat here waiting for processing. You are showing with this little sign that you care for me as a patient, as a person. Yeah. So I agree. Sometimes it can be fast, but I think both would help to have this respect for persons and to have more time for patients. That would be a perfect combination. I was talking, by the way, here to the clinical director, and he said what he did is a couple of months ago, he invited a butler, so a really English butler, as you know from the English movies, and he said, well, I wanted them just to give us a talk about what does it mean to give a really good service, you know. And this sounds maybe completely crazy. Now you're taking away your high-paid staff and you're forcing them to listen to a butler. But I think he has many, many good messages about what does it mean to treat a person and let him or let her feel really comfortable and understood. Yeah. Yeah, I fully agree on that.
Thank you. Next question from Jérôme is already typed, so I can just read it out loud. So he says, I worked in an elderly home in Neukölln, that's in Berlin, for 3 months last year. I experienced that also monetary compensation salary was very low and this stressed my colleagues out. Yes, that's a fact. Where is this mentioned in your system? How do you solve salary with lean?
Yeah, well, you know, as a consultant, we had this talk or this saying that if you pay peanuts, you will get monkeys. So it's part of the respect. Obviously, many people work in healthcare not because they want to get rich, some do, yeah, but they have a really passion for that. And paying them low, but sending the signal, you know, basically everyone could do it. So this is a real, real big issue. So as I said before, yes, lean is also about efficiency. So what this means is that you can do the same work with less effort. And so let's imagine you're scheduled to do this 20 operations a day and you find that you were wasting a lot of time because you have this preparation meetings where everyone is waiting for the surgeon to arrive and he does not arrive. And so you're wasting the time of everyone and you improve the process. You suddenly have resources free. And now it's up to the managers to decide, what do we do with this free time? Do we spend it with more patients? So this is the business side. So we can have more patients per day, earn more money, and therefore hopefully pay my staff better? Or do we use these free resources to spend more time with my patients and to try to improve, maybe we're not good enough in our service up so far? So there is a strong link, what I'm saying, with profitability of an organization and how much waste they have in the process are clearly related with each other. It does not mean that if you're efficient that you're really going to make your pay better to your staff, but hopefully this is what the managers decide to do, that now we can afford to have a bonus for our people.
Yeah, and that leads to the next question, to my question. And if you have more questions, please either chat or raise your hand with the icons under the participant list. So the question would be exactly that way. What did you experience what is it from your experience? What happens once people make time for stuff? Because I would at Helios in Germany, profitability is key. So once you have free resources, either you send them away or send away the it's probably extremely formulated, but once you have resources that are not used, then you just remove their resource, let's say. And I can imagine it happening in Germany. What is your experience? What's happening once they have resources free?
Yeah. And that's a very interesting question, because lean should and cannot be ever used to be a cost-cutting method. Let's say that you're at Helios Clinic or any clinic is making a loss every year. So I would strongly recommend you not to use lean to reduce the cost. Why is that? Because as I said before, one of the basic pillars of lean is having the people, the staff themselves come up with ideas how to improve our work. So I'm not telling them how they should rearrange the material. I give them tools and the power to understand, oh, we have a problem with our materials, we should do something there. Yeah? So, but if you have a system where you ask your people, come up with ideas, let's say increase the efficiency here in our house. And by the way, if we manage to reduce our cost by 10%, we're going to lay off 10% of you. So this does not work. No one on this planet would come up with ideas how he or she can make herself redundant. Therefore, what happens is a different thing. And this is very typical for our hospitals. At least I haven't seen a hospital where staff is not stressed and have a lot of additional hours. Yeah? So most of the time is we don't want to lay anyone off. We would just be happy if we don't have to work on Saturdays and Sundays and I have here 100 times of overtime that I cannot anytime compensate. So if you could help us to reduce all this firefighting we have to make the whole things calmer so that we make in our 8-hour shift what we are supposed to do, then we don't have to work overtimes and then you're already saving a lot of money there. So this is basically the moment we're not in a situation, and we will not be in the future because the healthcare sector is growing and growing and growing. So the efficiency gains that we have, we're never translating that in dismissing people. We are translating them in maybe having more treatments because, well, we're just understaffed in this country and in many other countries all over the planet.
And I think generally that's from my experience, if a middle manager or a line manager initiates a lean project, he or she doesn't want to do it for cutting costs and cutting resources. He or she wants to do it to achieve something bigger, better for the patients and for the employees so far. So I think lean has a lot of goodwill in it, and it's not there just to cut resources.
It has been misused for that.
Yeah.
Sorry, just to add on that. You know, sometimes when you come to a hospital, you mention the word lean and they turn around and, oh, that's a difficult one, because it has been misused on this planet before. Yeah. So you can do it exactly once in your organization, that you trick people into helping you improve the process and dismissing them afterwards, but you would be ruined for the rest of your life. So I would never advise to do any one of that, but there are always black sheep out there. So what can you do?
There's another question from Jerome about reducing waste. Which is an interesting question. So reducing waste caused for a situation in the Netherlands where we had only 7 intensive care beds per 1,000 people, where in Germany there are 21 per 1,000 people. That's true. And Germany wanted to close and still wants to close a lot of hospitals because we have too many beds. Not anymore, I guess. This caused huge stress during Corona times. How do you combine lean with the recent developments?
Yeah. So I would say this is maybe some people didn't understand what waste means, you know. Is it waste if you have reserves? If you have a firefighting team sitting around, is this waste? They're not doing anything. They're not creating any value. So you could just dismiss them. But then suddenly a house burns and then you're happy that you have the fire people out there. So I would say just reducing your reserve to react in a situation of crisis, that's not reducing waste. This is just playing around with fire. So I would say, yes, it has been, you have to think how much reserve do I need to have for a certain future. And to be honest, no one on this planet really calculated for what happens if we have the same situation as 100 years ago. So let's make our reserves as high that we can cope with that. So yes, no one was prepared for that, but I wouldn't say this is a lean or not lean issue. This is just a question about how much do we want to invest of our resources on being ready for any case in the future that might arise, and how much value do we place in being agile and ready for any crisis that come up. So what I would say is, if I look at chaotic situation where we need 250 steps to dismissing someone, you know, in having that reduced to, let's say, 50 steps is always going to help, with Corona or without Corona. So I think to get rid of all the bureaucracy we have in our organizations this day is going to be help us to be more agile, more flexible for anything that might happen in the future. So this is for me not a contradiction of the philosophy.
Yeah, makes sense. Okay. Thank you. There is one more question from Jan. Hi, Jan. Is there a lean way to manage stakeholders with many different interests?
Yeah, well, that's difficult for sure. So if you look at the professions that you have in a hospital or in any other organizations, they don't overlap always their wishes. So that's for sure an issue. So we have sometimes projects where you are talking to nurses all the time and you improve the processes for them, and they have a beautiful, quiet, balanced process. But then you notice, well, but now we're making life much harder for our guys in the logistics on the pharmacy. So you have to be very careful. Then when you optimize something, that you don't solve the problem of few people, but just push the problem out to other peoples out there. So how you could avoid that is basically trying to have really, and we say here like path way of path thinking about the flow through your hospital. So the best projects are when we're not going to the laboratory and improving there, and then we move to the bed ward and making their improvements, but we map down, like you have your customer experience, we have our patient experience from I arrive at 5 o'clock in the emergency room until I go home. What are the 20 different steps that happen there? Which different professions are involved? What problems come up there? And I have a representative from every single of these professions there, and we together try to come up with a solution where we make the patient flow without just pushing the problems around in the organization. So yes, that's very challenging. It's pretty easy if the logistics guys say we are going to improve our processes within our environment. That's the easy project. The harder projects is where you have many different professions involved across all the hospital, then the complexity explodes. Well, yeah, that's part of the job.
Thank you. Also a question.
I think
yeah.
Jan wants to say something on that.
Thanks. Yeah, thanks very much for your talk. I was just wondering if there are so many stakeholders, who can then play the lead or choreograph all of them, because they all think they're the most important ones, whether it's the clinical director or some kind of, I mean, I worked for a pharma company and they wanted to move in, and then there might be a startup which has a great digital health idea. So how do you get them all coordinated? I mean,
yeah. So if you're really serious about lean, what we observed is the successful hospitals in Switzerland, what they have is a lean professional team. So person like internal consultants, they're out there just for improving, making improvement projects and being the moderators of this improvement project. So the first idea is having a Gabor, but not only one Gabor, but having 10 Gabors maybe in your organization who are going to be the moderators of the process. Yeah. And at the end of the day, I would say it's not about improving the life of the staff. This is just a byproduct. What you focus on, and everyone can agree is, well, we have to make the patient flow here. And with that comes profitability, and with that comes a calm situation, stable process, and with that comes happiness from us. So it's like a chain there. And hopefully with such a moderator role, you have the chance in all this politics that happen within every organization, and just the one guy who is the loudest crying is going to get what he or she wants. That's not how things work. But having a, you know, when you have done the 20 lean projects as an internal consultant in your hospital, you have a standard way of doing things, and you have always the same problems, like, you know, sometimes very typical, some doctor who is fearing for her, for his position. And so these professionals, they know after a while how to deal with that situation. Yeah.
Great, thank you.
Can I jump in now? I just wanted to give a quick announcement that I'm not sure if anyone's in Berlin, but if you are in Berlin, we're not going to be around next month because we're taking a summer holiday. But I did want to give a special announcement that on the 7th to the 9th, there is Jam Berlin, which is happening. And they're going to do a remote satellite event jam. Nicholas is here. He can turn on his camera if he's around. But they're going to do individual small teams. So you'll be in a team of 5 or 6 and you'll have your own little location. And then you'll spend the weekend coming up with great services. So if you've ever like told your mom or your partner, or maybe you have some other people, or what is service design, or this is what service design is, or design thinking, or anything like that, then I would say definitely send them to the jam, and that's where they can get really hands-on for the whole weekend. We used to run it for very many years, but now there's a whole new team and it's going to be really, really awesome. So I would recommend it to also recommend to other people. And there is the website as well, jamberlin.org, and all the details are there. And yeah, I just wanted to give that a quick shout out before you all ran away.
Cool, thanks, Adam. Are there any more questions? Because otherwise, thank you very much for Alfred. Thank you very much. It was very, very interesting. I hope you guys got a lot of new inputs, even as service designers or as other professions working in healthcare or outside of healthcare. So jamberlin.org for the next jam, service design jam, service jam. SDDberlin.com to check out the next event, which is most probably going to happen early fall this year, the next one after a summer break. Have a look at Marktplatz Gesundheitswesen. I posted a link in the chat for the podcast to listen to it because it's very, very interesting. There is even one in English if you would like to listen and follow up on lean healthcare. And anything else, Alfred, Adam, that I forgot?
No, everything is fine. I still have some beer left, so everything is good.
Awesome. So thank you very much again, you guys. Thank you very much again, Alfred, and have a nice summer, and see you all next time.
Stay healthy.
Thanks,
Stay
everyone.
healthy.
Thanks, Alfred. Bye. Go to the jam.